Welcome to the video. Please watch the video completely.
In this video, I will discuss the socio-emotional problems in children and causes of negative behaviors like aggression and quarreling. Socio-emotional problems in children. Normal, healthy, balanced and well-adjusted personality development is the goal of education. Social-emotional development represents a specific domain of child development. Socio-emotional development is an important component of personality formation. Socio-emotional development has been defined as the development capacity of the child from birth through 5 years, to form relationships and regulate emotions. It can also be defined as a gradual, integrative process through which children acquire the capacity to understand, experience, express, manage emotions and to develop meaningful relationships with others. Children who do not experience appropriate socio-emotional development are likely to have limitations in their ability to learn. In the long run, they face the risk of several problems such as delinquency, or achievement in school, poor physical health, etc. Socio-emotional problems manifest in children in various forms, such as temper tantrums, emotional outburst, usually associated with those in emotional distress, that is typically characterized by stubbornness, crying, screaming, violence, defiance, angry ranting, a resistance to attempts at pacification, defiant behavior, attention deficit and others. This is because negative emotions becoming dominant in such children. Childhood behavioral and emotional problems have significant negative impact on the individual, the family and society. And as already mentioned, these negative effects are commonly associated with poor academic and psychological functioning. There are other such socio-emotional problems in children. These have to be identified early so that normal socio-emotional development is possible and there is improvement of developmental outcomes. Whereas, the positive social and emotional development influences a child's self-confidence, empathy, the ability to develop a meaningful lasting friendships and partnerships, a sense of importance and value to those around him or her. Causes of aggression and quarreling in children. Aggression is a form of negative behavior. This involves opposition to others, as against getting along with others. This is accompanied by disposition to attack. Definition: feelings of anger or antipathy resulting in hostile or violent behavior, readiness to attack or confront is called aggression. Young children show aggressive behavior when they are angry. And aggression is accompanied by quarreling, at least in the early years. Younger preschoolers often engage in behavior involving hitting, kicking or shouting to obtain what they desire. Later, they may show overt aggression like harming someone through physical injury or threatening to harm. Such hostile forms of aggression often increase between the ages of 4 to 7. It has also been found that overt aggression is more common in boys. Girls may use relational aggression like social exclusion, rumor spreading, etc. Although most children learn ways to regulate themselves with appropriate guidance and direction from adults, but some children will continue using both physical aggression and verbal aggression. This may create problems at home, preschool or daycare center. Another temperamental behavior seen among children is quarreling or fighting. Fighting happens when a disagreement between two children becomes aggressive. For example, when they see a situation as unfair or when they think they need to assert their rights, when they feel that others don't understand their point of view. Children start quarreling or fighting. To take an example, we often find an older child teases a younger child just as a joke. The younger child doesn't like it and gets irritated. At home, siblings fight mostly when they compete with each other for their parents' attention or approval. It is also true that sibling fights are frequent when they are closer in age. Such disagreements between children, whether in school or at home, provides them opportunities to learn and practice social skills. Fights and quarrels provide chance to learn ways to resolve conflicts, and they may learn that fighting doesn't get them what they want. Fights and disagreements also help children to acquire problem-solving skills. Causes of fighting or quarreling. There are several causes for aggression in early childhood and even later in life. 1. One of the main causes is the frustration of a motive. That is, if a child wants something but cannot have it for some reason, aggressive behavior may occur. Aggression thus is often caused by frustration that is interference with goal-directed activity. Frustration of any need or ongoing activity, even play activities like block building, drawing etc., that restrains the child or expecting the child to do something she/he doesn't want to do provides anger and aggression. 2. Another cause of aggression is learning and modeling. For example, if aggressive behavior is rewarded, it will occur frequently, and aggressive behavior learned in one situation tends to be generalized or spreads to other situations. Thus, if parents encourage children to be aggressive in one set of circumstances, their aggression may generalize until it becomes a style of life. Parents can also serve as models of aggression for their children. Many experiments have demonstrated that modeling is an effective way to teach aggression. 3. Exposure to media, especially television shows and many video games in recent years. Aggressive behavior in children who are frequently exposed to such programs. Since aggression tends to spread and generalize, it is necessary that the society and community exhibits concern about the content of the television and video programs that children are likely to watch. It should be understood by parents and teachers, the pattern, the causes and the expression of aggression and fighting change with age. As children grow older, they learn to cope with frustrations, and learn socially approved and acceptable patterns of behavior. It is the responsibility of adults around the child to guide and direct children's aggressive behavior. The following are some suggestions to guide children's aggression. There are many ways in which adults can teach young children that violence and aggression, physical or verbal, is not acceptable. First and foremost, caregivers, parents or teachers, should not model, demonstrate, physical or verbal aggression, and avoid name-calling, or regular physical punishments in response to negative behaviors. Young children should not see adults treat each other in an aggressive or violent way. Parents who find themselves in a violent, dangerous or abusive relationship provide a very bad model to their children. Parents and teachers have to be consistent in dealing with and guiding children when they are aggressive. For example, suppose if a child has a problem of hurting other children, say something like, "Hitting is not okay. You need to spend some time by yourself and calm down." Sometimes it may be necessary to remove the child from an aggressive situation and help him/her to regain control of the emotions through pep talk or any other technique like timeout. There may be many other ways of dealing with children's aggression. The most important thing to be remembered is that parents, teachers or any other adult, has to provide a proper model. They should never try to stamp out angry behavior by punishing it. Attempt to teach the child not to be angry. They should also not try to suppress expressions of anger. These approaches are more frustrating and result in smoldering anger leading to hostility, which, like any emotion, can become generalized and extend to other situations.